Here we go, guys. Alrighty, guys. So coming back together, I am really impressed reading through all of the answer options that you guys have chosen and that you've put in the chat box for me. The majority of you indeed have gotten this one correct, and it is number 3. I can take up to 3 pills in a 15-minute period if I am experiencing chest pain. So these tablets, guys, they are heat and light sensitive. They should be kept in a dark bottle and capped tightly. An opened bottle should be discarded after 6 months of being open. So number 1 would be incorrect because of that light and heat sensitivity. If you keep them in your pocket, that will negate the effectiveness of the nitroglycerin. So please do not do that, and that is incorrect. Number 2, I can still take this with my vardenafil prescription, and we don't want you to do that if you know that vardenafil is the erectile dysfunction drug, or alpha blockers as well. They're contraindicated due to potentially fatal hypotension. So we know that nitroglycerin can cause hypotension, and so can vardenafil. So if you take them both together, that could cause our client to be fatally hypotensive. So we would not want to instruct them to take that together. And then number 4, I should stop taking the pills if I experience a headache. A headache is actually a common side effect with nitroglycerin. It's something that we would expect to occur alongside with flushing due to that systemic vasodilation. And we would not want you to discontinue the medication because this is a known side effect. So if you chose number 3, you are indeed correct. Alrighty, question number 2. A client diagnosed with stable angina is being discharged home on the cholesterol lowering drug rosuvastatin. The nurse should teach the client to report which side effects to the healthcare provider immediately. Number 1, abdominal discomfort. Number 2, insomnia. Number 3, a morning headache. Or number 4, muscle aches or weaknesses. So 2 minutes on the clock, guys. Which of these should be reported to the healthcare provider immediately? 2 minutes on the clock. Here we go. Alrighty, guys. So coming back together, excellent job. Let me reveal the correct answer to you. And that is indeed number four, muscle aches or weakness. Guys, rhabdomyolysis. I don't know if you know that term or if you've heard of that term, but this is the breakdown of muscle tissue that leads to the release of muscle fiber contents into the blood. These substances can be harmful to the kidney and often can cause kidney damage. The client should immediately report any signs of muscle aches or weaknesses to the HCP. So, early signs of rhabdomyolysis could be fatal. So, we've got to catch them very early on. So, that is something that we definitely need to teach our client if they are being discharged home on a cholesterol lowering drug. So, let's talk about one, two, and three. Why would these not be side effects that we should report immediately? So these can be considered side effects of the rovastatin. They are known side effects and are minor and do not need to be reported to the HCP immediately. However, if they persist, the client should consider reporting them to the HCP. But the nurse should teach all clients taking statin drugs, so atorvastatin, rosuvastatin, to immediately report that muscle ache or weakness. Okay. All right, excellent. Let's move to question three. So, question three says a client at 20 weeks gestation states that she started consuming an increased amount of cornstarch about 3 weeks ago. Based on this assessment, the nurse should anticipate that the healthcare provider will order which laboratory test? Number one, hemoglobin and hematocrit levels. Number two, human chorionic gonadotropin level. Number three, serum folate level. Or number four, white blood cell count. Which laboratory test should the nurse anticipate the healthcare provider ordering for a client who has consumed an increased amount of cornstarch? So I'm going to put 2 minutes on my clock here, guys, and go. Alrighty, guys. So coming back together, can anyone tell me the term that is used to describe an abnormal compulsive craving for and the consumption of substances not normally considered of nutritional value? Does anybody know what that term is? Oh, yay. I see lots of stuff coming through the chat box. So, yes, you guys are all correct. So, pica is often accompanied by iron deficiency anemia due to insufficient nutritional intake or impaired iron absorption. So, number one would indeed be the correct answer. We would need to check that hemoglobin and hematocrit level because the ingestion of cornstarch is considered pica. It's an abnormal craving for something that is not normally considered a nutritional value or, in fact, even edible. So, we would want to check her iron levels. But some of you chose 2, 3, and 4, and I want to talk about why that would not be why that would not be correct. So 2, HCG, that human chorionic gonadotropin level, is the hormone detected in a urine or serum pregnancy test to determine if a client is pregnant. It is not often affected by iron deficiency anemia or pica. Number 3, serum folate levels. Increased folic acid consumption is indeed necessary during pregnancy to reduce the risk for neural tube defects in the developing fetus. However, folate levels are not directly related to pica. And last but not least, number 4, that white blood cell count. A white blood cell count should be assessed when a client is suspected of having an infection, and there is no indication that this client has an infection. So it would indeed be number 1. So great job. Question number 4. The nurse is preparing a nutritional teaching plan for a client planning to become pregnant. Which foods would best prevent neural tube defects? Ooh, we just touched on that briefly during the last question. So is it going to be number 1, calcium-rich snacks? Is it going to be number 2, fortified cereals? Number 3, organ meats? Or number 4, wild salmon? So which of these foods would best prevent neural tube defects? So 2 minutes on the clock here, guys, and go. Alrighty, guys, so coming back together, who can tell me what type of food best prevents neural tube defects? What is it that a woman should consume daily who's trying to become pregnant? What do you guys think? We talked about it on the last question. There we go, Cindy. Yes, folic acid. So women who are planning on becoming pregnant should consume 400 to 800 micrograms of folic acid daily. So since we know what foods best prevent neural tube defects, and we know that those are foods high in folic acid, we are looking at these answer options saying which one of these answer options is high in folic acid. And that's going to be number 2, fortified cereals. So food options that are rich in folic acid include cereals, breads, pastas, right? So those carbs, right? And green leafy vegetables. So anyone who answered number 2 as being correct, you were indeed right. But let's talk about why number 1, number 3, and number 4 are not necessarily the foods that would best prevent neural tube defects. So number 1 says calcium-rich snacks. Adequate calcium intake is especially important during the last trimester for the mineralization of fetal bones and teeth, but it does not help prevent neural tube defects during the time in which the woman is wanting to get pregnant or during the very beginning stages of pregnancy. Number three, those organ meats, such as liver, may contain moderately high levels of folate, but are consumed more for their high iron content, which can promote red blood cell formation and prevent maternal anemia. So, organ meats are better suited for a woman trying to prevent anemia during pregnancy. And number four, wild salmon. A prenatal diet rich in omega 3 fatty acids is important for fetal neurologic function and is linked to a lower risk of preterm birth. Dietary sources include wild salmon, anchovies, flaxseed, and walnuts, but this does not directly correlate to the prevention of neural tube defects. So, for those of you, for question four, answer number two, fortified cereals, because they are rich in folic acid. Great job, guys. So, one more question, question five, and then we will move into our case study. So, question five says, a nurse is teaching the parent how to care for a newly circumcised newborn. Which statement by the parent indicates that further teaching is needed? So, guys, this is one of those negative query questions. So, we are looking for the answer option that is wrong. Number one, discharge and odor indicate infection of the circumcision site. Number two, I will clean the area with alcohol-based wipes or soap water. Number three, an infant crying during petroleum gauze changes is expected. And number four, the diaper should be changed at least every 4 hours. So 2 minutes on the clock here, guys. Which of these statements indicate that the parent needs more teaching? Here we go. Alrighty, guys. So coming back together, let me reveal the correct answer to you. And the correct answer to question number five is indeed going to be number two. I will clean the area with alcohol-based wipes or soap water. This is the statement that is incorrect. Whenever you get a cut, right, or if you had surgery or anything like that, if you get a cut, you fall, or your kids get a cut, they fall down, and you're cleaning it out and you pour rubbing alcohol over it, that's going to sting, that's going to burn, right? Because that's the nature of rubbing alcohol. Same thing with those alcohol-based wipes. If you are cleaning a newborn's newly circumcised penis with alcohol-based wipes, that's going to burn, that's going to sting, that poor baby is going to cry. So here in the United States, we do not clean that with alcohol-based wipes. Soap water would be appropriate, but the alcohol-based wipes is what makes this statement incorrect. Now, for those of you who chose 1, 3, or 4, these statements are all correct. Discharge and odor indicate infection, which is 100% true. Number 3, infant crying during petroleum gauze changes is expected. Yeah, it is expected during those diaper changes because that's a very sensitive area. And discomfort, though, it's only going to last for a few days, but you can do comfort measures such as holding or feeding, things like that after the diaper changes to help that to soothe your infant. And then number 4, the diaper should be changed at least every 4 hours. Absolutely, if not more. Okay. You absolutely, I had somebody put in the chat box, do you put a diaper on a newly circumcised newborn? Absolutely, unless you want pee and poop to get everywhere. But yes, that is perfectly normal. Once you put that petroleum gauze around the penis, you can absolutely put a diaper on, but you do need to change that diaper at least every 4 hours when it's soiled to keep the area clean and also to assess for any evidence of infection or bleeding. Okay, so every time you change that diaper, make sure that it's clean with soap and water, put some more gauze or ointment on, and then put the diaper back on. Now, the diaper should be secured loosely, okay, to minimize the pressure against the healing circumcision site. You don't want the diaper so tight that site is being what's the word? That site is constantly having pressure on it. So you want to make sure that the diaper is a little bit on the loose side, but yeah, you wouldn't want the baby to get pee and poop everywhere. So to answer the question here in the chat box, yes, you do put diapers on infants even if they are newly circumcised. So the answer is number 2. All right, guys, so let's move into our case scenario of the day. So the remaining set of questions is going to be derived from the case study. When the NCLEX exam moved to the NGN version back in April, one of the biggest changes was the incorporation of case studies. Why? Because they wanted to test your real world critical thinking skills. In these case studies, they reflect the kind of critical decisions that nurses have to make in a variety of healthcare settings. So that's why we review them here in Question Clinic so you get a better feel and a better understanding of how these case scenarios work. Now, also in your Nurse Achieve account, you have over 145 case studies for you to practice. So in addition to coming to our question clinics each week, we highly recommend that you do self-generated case studies because it's going to help you to further develop and to learn how these case studies work. Alrighty, so at the NCSBN, which is the governing body of the NCLEX exam, they wanted to combine the nursing process and the clinical judgment model in order to have a way to understand critical thinking. So this is how they did it. The first step of the nursing process is to do an assessment, right? We all know the nursing process. We all learned that in nursing school. That has not changed. But what does this mean from a clinical judgment standpoint and from a critical thinking point of view? Now, step number 1 is to recognize clues, and you're saying, well, what matters most? The next step of the nursing process is to diagnose. This is steps 2 and 3 of the clinical judgment model. This is where you're analyzing clues and prioritizing hypotheses. So you're saying, well, what does this mean for my client and where do I even start? Next in the nursing process is to plan. This is step 4 in the clinical judgment model. This is where you're generating solutions and you're saying, well, what can I do as an RN? What is within my scope of practice? Next is implement. This is step 5 of the clinical judgment model where we're taking action and we're saying, well, what will I do? And last but not least is to evaluate. This is the 6th step of the clinical judgment model. And this is where you're evaluating the outcomes and you're saying, well, did this help my client? Is it making a difference? Alrighty, guys, so we have our scenario for the day. So please bear with me as I read this aloud to you. So CE is a 65-year-old man admitted to the hospital for complaints of flu-like symptoms for the past 5 days. He reports dyspnea on exertion, palpitations, feelings of restlessness, and insomnia. He has 1+ pitting edema in the bilateral lower extremities. 6 months ago, he was diagnosed with Graves' disease and was started on Tapazole, 15 milligrams per day. His past medical history includes congestive heart failure and hypertension. His admission vital signs are as follows. The temperature is 100.2 degrees Fahrenheit or 37.9 degrees Celsius. Heart rate is 134. Respirations are 20. Blood pressure is 150 over 90. And SpO2 is 98% on room air. So let's move forward and see what the rest of our tabs have to show. So our laboratory results are as follows. Hemoglobin is 11.8, hematocrit 36, sodium is 141, potassium is 4.7, BUN is 33, creatinine is 1.9, T4 is 14, and T3 is 230. Now, on the NCLEX exam, there will be the reference ranges for your laboratory results, so they will provide you with those. So you don't need to know those to be successful in the NCLEX exam. But I will tell you, to be an efficient nurse at the bedside here in the United States, you do need to know your laboratory values. You need to know what an unexpected hemoglobin level is. You do need to know what a low sodium level is, because if your client is experiencing symptoms, say, of low sodium, and you get that back on a iStat machine, which is a machine that can very quickly tell us some lab results, you need to be able to know and understand. So what I'm saying is that though you don't need to know your reference ranges for the actual NCLEX exam, you do need to make sure that you know them when you're here practicing in the US. Moving right along, some medications. So methimazole, 15 milligrams PO daily, furosemide, 40 milligrams PO daily, and dexamethasone, 10 milligrams IV every 6 hours. See what the physician has ordered. So the physician has ordered a diet as tolerated, daily weights, strict eyes and nose, and a 12-lead ECG stat. Alrighty, so question 6 says, click to highlight which findings require immediate follow-up by the nurse. Now, the case study on the left-hand side has remained the same. So because you do not have the function of clicking and highlighting on this Teams platform, I am going to ask that you just type in the words or phrases in which you were to highlight. Put them all in one message, please, so that I can read your answers grouped together. I will give you 2 minutes, and then we'll come back and we will review which requires immediate follow-up. So words or phrases, guys. Here we go. 2 minutes on the clock. Alrighty, guys. So coming back together, I'm reading through everything you guys are putting into the chat box, and great job. I know it takes a while to be able to type all of those things, so you can continue putting them into the chat box as we review. So thank you, thank you. But on the actual NCLEX exam, to highlight, you would just simply click and drag. Okay. All right, so let me reveal there are 5 words or phrases that we would want to follow up on. So as nurses, the fact that our client is reporting palpitations, Feelings of restlessness, insomnia, heart rate is 134 and blood pressure is 150 over 90. Um, these are the findings in which we would want to follow up on. Okay. Alrighty, so let's move forward to question 7. Oh, and dyspnea on exertion. I'm sorry, that was the last one, though it came first. So dyspnea on exertion, palpitations, restlessness, insomnia, high heart rate, high blood pressure. The temperature is a little elevated, but that would be nothing that we would necessarily want to worry about that would require immediate follow-up. So good point, Kingsley, but that would not be included here. All right, so question number 7. So let me take a look. So the case study information remains the same. Laboratory results are the same. Medications and physician orders. So question 7 says, click to specify if the item is consistent with myxedemia or Graves' disease. So how this is going to work, I'm going to say the assessment. I'm going to give you 30 seconds to you can either put an M or a G into that chat box for me. Then I'll reveal the correct one. So we'll just keep going through that way. I read the assessment, 30 seconds, reveal the answer. So what about weight gain? Is this related to myxedemia or Graves' disease? All right, so it's going to be myxedemia. What about exothalamus? Is that related to myxedemia or Graves? And can anyone tell me what exothalamus is? Does anyone know what that's also referred to as? Bulging eyes, yes. So this is commonly seen among clients with Graves' disease. So good job. And going back here real quick to the weight gain, I realized I didn't explain that. So with myxedemia and hypothyroidism, there is decreased metabolism, which does indeed lead to weight gain. Okay. Great job, guys. For those of you who know that exophthalmos is the bulging of the eyes, perfect. What about this next one, of which I am not 100% sure how to say it, but we call it PTU here in the United States. So PTU, is this myxedemia or is this Graves? 30 seconds. All right, great job, guys. So PTU is indeed an antithyroid medication. We think of, when we say PTU, that acronym, we think of it as put thyroid under. Okay, so it is for someone with Graves' disease. What about levothyroxine? Is this for myxedemia or is this for Graves? What do you guys think? Alrighty, so this is indeed myxedemia. So for those individuals who do have hypothyroidism, they are often on levothyroxine for their lifetime. What about the next assessment? Increased TSH, low T3, and T4. This myxedemia or Graves? Alrighty, so it's myxedemia. So that increased TSH, low T3 and T4. So the thyroid gland is producing a lot of thyroid hormones. The pituitary gland then increases the production of that TSH. So that is why the TSH is lowered. The thyroid gland isn't working properly, so you're going to have a low T3 and a low T4. So, with that being said, the exact opposite would then be Graves'. It would be a decreased thyroid stimulating hormone with a high T3 and a high T4. All right, and what about avoid iron rich foods? Is this going to be for a client who has myxedemia or Graves'? What do we think? Great. So this is going to be in a client with Graves'. So because that thyroid gland uses iodine to produce the thyroid hormones, too much iodine can indeed make Graves' disease even worse. So there we go. All right, let's move forward to question 8. Alrighty, so we have an update on our case study. So it says right there in the middle of the screen on the left-hand side, a few hours after CE got admitted, he becomes severely restless and is disoriented to person, place, and time. His ECG strip reveals a new onset of atrial fibrillation. Current vitals are as follows. He now has a temperature of 104 degrees Fahrenheit or 40 degrees Celsius. His heart rate is 180 and irregular. Respirations are 32 and labored. Blood pressure is 174 over 82. And his O2 is 95% on 2 liters via nasal cannula. So, question 8 is a two-part question. It says, what complication is most likely happening? Do we believe this is sepsis, thyroid crisis, or pulmonary embolism? So I'm going to give you guys a minute. Type in the chat box for me. What do we think is happening here? Alrighty, guys. So thyroid crisis, and what would be the priority nursing action here? Administer oxygen, notify the rapid response team, or prepare for a cardioversion. Alrighty, so we would want to notify the rapid response team. So who can tell me what is the other name for a thyroid crisis? I saw some people putting it in the chat, but what's another name for thyroid crisis? Anybody know? Yes, there we go. They're all coming through now. Thyroid storm. All right, so with thyroid storm, those signs and symptoms are elevated blood pressure, tachycardia, fever, and increased respirations. And for those of you who knew that this was thyroid storm, we know that this is a life threatening condition. This is a medical emergency. The nurse must notify the RRT, which is that rapid response team, and the physician immediately. In this scenario, if the patient is not already on oxygen, then oxygen therapy would then be started right away. But instead, our client is on oxygen. So if our client was not already on oxygen, that would be the priority nursing action. But our client is already on 2 liters nasal cannula, so our priority nursing action is to notify that rapid response team. Okay. All right, guys. Excellent. Very good. Let's move on to question number 9. So, question number 9 says for each body system below, click to specify the potential nursing intervention that would be appropriate for the care of the client. Each body system may support more than one potential nursing intervention. All right, so I'm going to read the body system. I'm going to give you 1 minute to give me the potential nursing intervention for that body system. We're going to go one by one. And I would like for you to put a 1, a 2, or a 3. You do not need to type out the entire answer option. And as it says, each body system may support more than one. So if you believe that it's more than one, you could put 1 and 2, 1, 2, 3, 2, 3, whatever it is that you feel it is, okay? But I do not need you to type out the entire phrase. So, neurological is the body system we're going to do first. Potential nursing interventions: monitor neurological status, prepare for EEG monitoring, implement seizure precautions. So, 1 minute on the clock. Please tell me which ones you feel are pertinent to and appropriate for the care of this client. All right, so for neuro, it is going to be 1 and 3. Monitor their neuro status and implement seizure precautions. All right, what about for cardiovascular? Are we going to monitor the blood pressure and heart rate, measure eyes and nose once every shift, prepare to administer diltiazem IV? So 1 minute on the clock, guys. Alrighty, so for cardiovascular, it is indeed going to be 1 and 3 again. Monitor the blood pressure and heart rate and prepare to administer diltiazem IV. And what about for respiratory? For respiratory, we have titrate oxygen as ordered, instruct bed rest with head of bed no higher than 30 degrees, or notify respiratory therapists to prepare for immediate intubation. So 1 minute on the clock, which of these would be appropriate nursing interventions for the care of this client? Alrighty, guys, so this would indeed be number 1, titrate oxygen as ordered. All right, so question 10 says CE's family arrives to visit. They're asking for some clarifications on the management of CE's disease condition. Which of the following statements made by the nurse are accurate? Ooh, we have a select all that apply to end our session today. So select all that apply. Number one, his thyroid crisis may be precipitated by possible infection. Number two, if radioactive iodine therapy is used to manage his Graves' disease, CE will need to be isolated because he will be radioactive. Number three, dry eyes from exophthalmos can be managed by using artificial tears. Number four, while on radioactive iodine therapy, CE must immediately report throat dryness and irritation. Or number five, because he developed atrial fibrillation, he is now going to live with it the rest of his life. So 2 minutes on the clock. Which of these statements by the nurse are accurate and correct? Select all that apply. Here we go. B. Number one, thyroid crisis may be precipitated by a possible infection. And number three, dry eyes from exophthalmos can be managed by using artificial tears. So, number one, with that thyroid crisis, it could be precipitated by a major stressor, such as an infection. He said that he did have the flu. Other possible precipitating factors include medication noncompliance. And then number three, the dry eyes, it is associated with dry eyes and periodic photophobia. So management of this would include things like wearing sunglasses when outdoors, using artificial tears for moisture, taping the eyes closed at night, using hypoallergenic tape, cool compresses if irritated, and reporting any changes in vision to the physician. Now, for 2, 4, and 5, why these would be incorrect. So number two says, if radioactive iodine therapy is used to manage his Graves' disease, he will need to be isolated because he will be radioactive. So radioactive iodine therapy, also known as I-131, is an option to manage thyroid crisis. Another option is a subtotal thyroidectomy. Radiation precautions are dose dependent, but the dose typically used to treat hyperthyroidism is generally low enough to allow for outpatient administration. Urine, saliva, sweat, and feces will contain RAI, but the client will not be quote unquote radioactive. Instructions to give your client would include things such as increasing oral fluid to intake to enhance excretion, use individual eating utensils, Flush the toilet twice after each use for the first 48 hours. Avoid kissing or holding a baby or a child for up to 72 hours. RAI is best administered on an empty stomach because of the risk of vomiting, and maximum effects could take 2 to 3 months to be fully realized. And then number 4, while on radioactive iodine therapy, you must immediately report throat dryness and irritation. So radiation thyroiditis, which is signs and symptoms of mouth and throat dryness and irritation, is actually common in RAI as a side effect. So symptoms are usually managed by frequent sips of water, ice chips, or the use of a salt soda gargle 3 times a day. There's no need to immediately notify the physician of these symptoms. And then last but not least, number 5, because he developed atrial fibrillation, he is now going to live with it for the rest of his life. Atrial fibrillation is not always a permanent complication of hyperthyroidism and would therefore make this statement incorrect. All right, guys. Well, that is all that we have for today. Thank you all so much for coming to our very first session of Question Clinic via Teams. I hope that you found that it was easy and user-friendly, and that we were able to get through this. I hope that you learned at least one thing today. If you learned one thing today, I would say this was a successful Question Clinic day. So I look forward to seeing you guys all again next week. From here on out, we will be utilizing this Teams platform. So in Teams, you guys can use those reactions. So you can use the hearts, you can use the hand clappings, you can use the thumbs up. And then, of course, putting your information into that meeting chat box for me to be able to read throughout the duration. So thank you so much. I do see somebody put in here about their ABAMS ID number. Megan, does that mean the ABAMS ID number is not needed because it was not asked when I was registering? Let me clarify if an ABAMS ID number is needed, and then we will get back to you with that, okay? All right, guys, thank you so much for coming, and I look forward to seeing you again next week. Take care and have a great rest of your day. Bye-bye.